Hey, it's Naturopathic Medicine Week, and I'm Dr. Brianna Botsford, the founder of Flow Functional Healthcare in Edmonton and a naturopathic doctor myself. This week is a time to celebrate naturopathic doctors, whole person care, and taking charge of your health from the inside out. This week, we're sitting down with our patients and colleagues who want to share their unique experience working with naturopathic doctors. Whether you're curious about natural medicine or ready to feel inspired to take action for your health, you're in the right place. So I am back for Naturopathic Medicine Week. It's Dr. Brianna Botsford, naturopathic doctor and owner of Flow Functional Healthcare. And right now I have the privilege of sitting here in the virtual studio with Michelle Jeannotte, who is our nurse practitioner at Flow. Michelle, can you introduce yourself? Tell us a little bit about your story. I'd love to hear from you.
Yeah, well, I'm Michelle. I'm the nurse practitioner at Flow. I've been a nurse practitioner for 12 years now. I wanted to become a nurse practitioner. We'll go back. I was an RN for quite a
Hmm.
while. I was an RN for 7 years before I went back and did my master's. And I worked primarily in home care in the home environment.
Hmm.
And I was really tired of just having to wait around to get orders to do things I knew or I had enough knowledge to do. So I was like, I'm
Right.
going back to school. I won't need any order sets when I'm a nurse practitioner. I can order my own medications and my own suture removals and all of those things. So I did my nurse practitioner program and I really liked primary care. Like I
Hmm.
liked being able to take care of patients, to hear their stories, to hear them out. And I really like doing procedures as well. That was kind of one of the things that I enjoy doing. How I came to be at Flow, well, I did a women's health course, a bioidentical health course during COVID. I was a bit
Hmm.
bored to learn more. Sure, just needed something to do, honestly.
Yeah.
I had young kids at home. We were all stuck in our homes, and I did this course and I started prescribing hormones, and it's really changed my life and it's changed my patients' lives.
Hmm.
And I met Bree from doing one of those. I did a virtual learning session for the Lois Hole Women's Society online
Right.
during that COVID time. I think that's how we met Bree. Long
Yeah,
time.
yeah,
And
absolutely.
I was looking for a new place to practice. So I was doing a primary care practice in people's homes, but I
Mhm,
was getting very busy and it just wasn't worth my time going into people's homes and doing
mhm.
physicals. So I was looking for a space and Bree was looking for a nurse practitioner. And I think it's a very good fit because a lot of patients that see naturopaths really like working with nurse practitioners as well
Mhm,
because we're focused on health and
mhm,
wellness and looking at the full picture.
mhm. Yeah, and, like, in our model with you at Flow, like, you also have a little bit more time, right,
Yeah.
than people might be used to.
Yeah. Typically, I spend on average in a consult visit about 30 minutes. And when I do a full plan, when I'm talking about hormones and the full picture, I do spend about 45 minutes with my clients. So
Mhm.
it does, I mean, we don't have that luxury of time in regular primary care clinics.
Right.
Everything is like 15-minute intervals, like getting people in and out. So I
Mhm.
really enjoy having that extra time to spend with my patients.
And it's been such a benefit for our patients as well, like for patients who've been seeing naturopathic doctors for years. The clinic's been open for 6 years. We've had the amazing privilege of working with you for a few years now, and having like both options, like having primary care, which I know isn't like the hugest part of your practice at Flow, but the hormone care specifically, because then when we're able to say, you know what, we're up against a wall here with our like lifestyle, nutrition, herbs, supplements, vitamins, like we really do need a little bit of hormone therapy. You're able to see those patients and help them come to a solution that really truly is integrative. Like we're
Mhm.
integrating your expertise and the lifestyle foundations and kind of getting really good outcomes for those
Oh,
patients, I
yeah,
think.
yeah. Well, I have the same conversations that our naturopathic doctors do, that like hormones are not magic.
Right.
They're incorporated with everything else, lifestyle interventions.
Mhm.
And I do find that patients are extremely well managed. They know everything that I'm about to talk to them about when they come from our naturopathic doctors at Flow. It makes my job very, very easy to prescribe hormones and
Yeah.
they just get way better outcomes.
Percent. Yeah. And It's one of those things where it's like, it really shows how we can blend both, right? It's not like you can only do pharmaceuticals or hormone therapy, or you can only do naturopathic or lifestyle, right? Like, it's like probably at the end of the day, to get the best outcomes, we need a little bit of column A, a little bit of column B.
Oh, absolutely. Yeah.
Have you is there anything that you have been surprised about, like, working in a clinic with naturopathic doctors? Like, might be just, like, how much we talk about farts, or maybe it's, like, something more like you're surprised about working with our patients more so than, like, the vibes?
Well, yeah, there's a lot of things that surprised me actually. Like, I really didn't understand the scope of naturopathic doctors when I
Right.
started, and it really surprised me at how large of a scope and how much knowledge naturopathic doctors have.
Mm,
So you guys are my go-tos for when I'm like, this is out of my scope, especially when it comes to like GI stuff or food
mm,
sensitivities, nutritional teaching. You guys have leaps and bounds knowledge, and you also understand hormones as well,
mm,
right? Since require hormone therapy, just
mhm,
not able to prescribe it in Alberta, and I
mhm.
think it's a really good fit. I really love our patients too at Flow because
Yeah.
they're patients that really want to take charge of their health. Right? Like
Mhm.
they're wanting to be proactive, they're looking at longevity, they're looking at optimization, like they're patients that are looking at things a little bit differently when it comes to their health.
It's so interesting to hear you're like, I didn't really fully understand what naturopathic medicine is, or right. And that's part of why we're doing this project, is because we're like, okay, we know that there are healthcare providers, not to mention the general public, right? That like don't know what it is that we do, how we approach patient care, how we're not anti-conventional care. If anything, it's about that blend. So it's like
Mhm.
it's lovely to hear, and I know because you are so well connected too, and in with your nurse practitioner colleagues, you have your monthly or quarterly meetups with your colleagues, right? And like you go to your conferences, and I feel so grateful that you're able to share your expertise in working with naturopathic doctors. And it really helps us as a profession, I think, when we have other healthcare providers that understand what we do, that we're not just like, fairy dust and magic and kind of
Mhm.
woo sort of things. Although, like, we do bring in the elements of like the mind body connection and those kinds of things. But, it's that, it's not this crazy system of medicine or something that's really out there.
Yeah, and I kind of tell patients like if you've explored every avenue with your primary care practitioner and you're still not getting to where you want to be, like it's a good idea to touch base with naturopaths because they see things a little bit differently.
Yeah, like even the way we're interpreting blood work and stuff like that. Like I know I've also learned a ton from you with that. So that's like so fantastic to be able to sit and collaborate and look at, like, I might have this opinion about a lab result and you might have that opinion, but then we can come to like a mutual conclusion based on the patient story and the case and everything like that. It also
Mhm.
like just, helps us help our patients more, right?
Yeah, yeah,
Yeah. Yeah.
absolutely.
Is there, I know you kind of alluded to it there, but like, is there anything, is that kind of the advice you would give to somebody who's unsure about seeing an ND, that if you've tried everything else, like this is a good thing to try? Is there anything else you
Well,
would
yeah,
say?
well, it's like people who are wanting to optimize, right?
Right.
I often refer patients who have like a lot of questions about
Right.
supplements in general,
Hmm.
like that I don't have the knowledge that are like, oh, what do you think about this? What do you think about this? I'm like, well, you need to talk to our naturopaths, right?
Yeah.
Like,
Yeah.
or if we're really trying to tweak out something that like for me, it's a lot of like GI stuff that I'm like, oh, we've tweaked out everything else. Like maybe we
Hmm.
need to see a naturopathic doctor for maybe
Hmm.
there's some SIBO going on or something else that we can treat that practitioners don't really screen for out in the community.
Right. It's just a different, like you said, looking at it through a different lens, really taking into account how all the systems are like intertwined. And then, yeah, let's like get that sort of second opinion or third or eighth or whatever
Yeah, yeah.
opinion on what might be going on. Yeah. Since working with the clinic, is there anything you can say has really changed for you, either in your practice or even like at home?
Well, a lot has changed for me since I came to the clinic, honestly.
Yeah.
I've gotten really, really busy in my
Yeah.
panel, which I'm so grateful for, like, every day.
Yeah.
Yeah, so I'm, like, seeing, like, a very diverse group of patients, mostly for hormone health and, like, menopause, perimenopause, PCOS,
Mhm.
and male clients. that are often
Hmm.
referred by their wives or their
Yes.
partners that are like, "Come
Yes.
on in," because we can optimize meals as well.
Uh-huh.
I work 3 days from home too, which
Yeah.
has really changed my life significantly in that I'm
Mhm.
able to be home with my kids more often. So,
Mhm.
I can be home if they're sick and I can still work or take some calls, and it's been life-changing. Honestly,
Yeah.
my cortisol has come down tremendously in the last 2 years.
Right. So like not only has your work life changed, but like you're personally like noticing changes in your
Yeah,
well-being because you're
absolutely.
like
Yeah.
the way we've been able to approach our practices and like, as a clinic owner, like that's really important to me that people feel like I want people to feel excited and happy and grateful when they show up to work, not like, oh, I have to do another day of patients, right? Like that's not how we want people to feel when they're ultimately serving other
No.
people. And so
Yeah. No, I feel like every day is like an opportunity to help
aw,
somebody feel better, honestly. Like, I'm very
yeah.
grateful when I come to work. I'm grateful that people seek me out or that they tell their friends about our
Mhm.
clinic and that I get referred such lovely patients from our naturopathic doctors. Like, I'm very grateful.
Yeah, and we are so lucky, Michelle, to have you. Like, having you join the clinic has just, like, elevated the practice in so many different ways, and I just feel I know we said grateful about a million
Yeah.
times, but I feel so much like depth of gratitude for you and your practice and the benefits that our patients are seeing. So, thank
Oh,
you for
yeah.
being part of our clinic. Thank you for being in this project.
Yeah,
And
of
we'll make
course.
sure that we share this with all the other NPs out there so they know they can send people your way.
Yeah,
And
absolutely.
yeah, we're just so lucky to have you. So thank you and thank you for your time.
Yeah, you're welcome.
Thank you so much for watching, and a huge thank you to our guest for sharing their story today. If this conversation sparked something in you, don't wait. We're here to help. You can schedule a complimentary 15-minute visit with one of our naturopathic doctors at Flow Functional Healthcare in Edmonton today, or give us a follow, like, or share this video to help us help more people live healthier, more energized lives.